Hi, I'm Terry Fagan. I'm the Director of Clinical Services at Consanas Pharmacy. It's been a busy week as the review of the COVID booster dose has moved through the process. I've followed the action every step of the way, starting with the FDA's Clinical Vaccine Advisory Group, who reviewed the Pfizer vaccine data, and they voted to approve boosters in certain populations. The FDA then moved to amend the EUA, or the Emergency Use Authorization, which was followed by the ACIP meeting. That's the Advisory Committee on Immunization Practices. And then finally, the CDC gave their final stamp of approval. You know, it's like the old adage about making sausage. The process is not pretty to watch, but the end result is good. For our staff and residents of long-term care, it's another tool that will add a layer of protection and help save lives. Before we discuss who is eligible for a booster dose, let's review 3 important points. First, you need to know that for now, boosters only apply to Pfizer vaccine and to those individuals who received Pfizer as their initial vaccine series. The data for the Moderna and the J&J vaccines is expected to be reviewed in the upcoming weeks. Individuals that received either of these vaccines for the initial series are encouraged to wait to receive a booster dose, as it is not recommended to interchange brands of the vaccines. Second, as a reminder, both the mRNA vaccines, Pfizer and Moderna, have already received an emergency approval for a 3rd dose, not a booster dose. This is for individuals who are moderately to severely immunocompromised. This dose is given at least 28 days following the 2nd dose in the series. While the 3rd dose is for those individuals with certain immunocompromised conditions, booster dose is intended for people that have had a sufficient immune response to the primary vaccine series, but may benefit from another dose at least 6 months after completion of the series. This dose is intended to boost an immune response that may have waned over time. Finally, the booster dose is only approved for the Pfizer vaccine for those eligible individuals at least 6 months after the 2nd dose of the series. Let's review who the CDC has identified as eligible for a booster dose. The recommendation for who is eligible is divided into 2 categories. The first is those who should receive a booster, and the second is for those who may receive a booster. Let's start with the 3 populations that should receive a booster dose. First is individuals 65 years and older. Second is residents living in long-term care facilities. And third is individuals aged 50 to 64 years with underlying medical conditions. So some examples of underlying medical conditions that could increase the risk of getting severely ill from COVID are things like cancer, chronic kidney disease, chronic lung disease, dementia, diabetes, heart conditions, stroke, high blood pressure, obesity, and HIV. These are just a few examples, and any questions around medical conditions that might qualify for a booster should be discussed with your healthcare provider. The second recommendation category is for who may get a booster, which includes 2 groups. The first is people aged 18 to 49 years old with underlying medical conditions. They may receive a booster based on their individual benefits and risks. Second are people aged 18 to 64 years who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional setting. They may receive a booster based on individual benefits and risks. This is where long-term care staff would be eligible for a booster. I hope this latest news about the emergency use authorization for a booster dose helps instill confidence in everyone that the vaccines continue to meet the high standards for safety, effectiveness, and quality that is required of the FDA. It is also important to know that medical experts continue to emphasize that all COVID-19 vaccines are highly effective in preventing hospitalizations, in severe disease, and even death, even with the widely circulating Delta variant. However, the boosters will offer an extra layer of protection for our highest risk population. Finally, a reminder that we have adequate supply of the Pfizer vaccine through Consanus Pharmacy. Many of you are already activated in the Consanus Continuity Program, and if so, you may start ordering vaccine for delivery now. If you have any questions about how you can order the COVID-19 backpack or other questions around boosters, you can contact your nurse consultant, your pharmacist consultant, or visit the Consanus website. Thank you.